Welcome back. Let's pick up on the breaking news that we're tracking tonight as we wait for the President to speak. The Department of Health confirming a short time ago that we now have more than 3,900 confirmed coronavirus infections, COVID-19 infections, 75 deaths. The number of deaths has risen by 10, and the coronavirus infections are up 318 cases. So what do these numbers tell us then? We're joined by Alex Welte. He's a research professor at the SA Center for Epidemiological Modelling and Analysis. Prof, a very good evening to you. Thank you for being with us. So we're seeing this jump of 318 in the number of infections, deaths rising by 10 to 75. To lift or not to lift the lockdown remains the question. What do you say?
Well, I think we mustn't get lost in the details of the data of one day. You know, it's a bit like watching the stock tickers and the exchange rate tickers on the bottom of the screen that are often, run on news programs, and they really don't mean anything. And we can't make decisions based on those numbers. So one day's blip, it just doesn't mean anything. We have to look at, a period of several days, maybe a week is a good round number, and compare that to a previous week and not take it in isolation, maybe compare it to the previous 2 weeks and understand what the trend is. But one thing by itself, I don't think we should interpret that in any way.
I'm glad you talk about the interpretation of the numbers, Prof, because I want to talk to you about modelling and just some of the projections that we've been dealing with since the start of this pandemic. If you read articles, you listen to the research from the health department, expectations as far as the number of infections and deaths vary. How accurate and how much attention should we be paying to the modelling and projections?
Well, not much. I mean, I think that these models are built out of desperation to try to understand what might be happening, what we need to be braced for, what is the worst case, what is the best case. But none of them should be taken seriously as predictions of what is actually going to happen. That's simply not possible. Even in places where the data is much more consistently collected than here, they also wait day by day, week by week to see, have we hit the peak, are we turning it around? There's no way to predict the future in any case, except, when will the sun rise tomorrow? But so I think it's hopeless to try to do that. These models are just a kind of a crutch to help us think through some of the things that might be, but they're certainly not serious projections of what will be. So I think we need to understand that and accept the uncertainty that we're living with at the moment.
What do you say then, Prof, to people who are listening to you and I have this conversation, who have been watching those numbers almost quite obsessively, people who are already so frightened about possibly contracting COVID-19, what it could mean for the health of the broader population, for their jobs? How do you convince them to take all of it with a pinch of salt?
Well, I don't know. I think the messaging also has to be that way, from the National Health Department and, I think experts or supposed experts, who weigh in on this or that angle, I think need to be open about the uncertainty. That's the nature of the scientific process, is to understand what is uncertain and to try to make things less uncertain. But this idea that somehow we could know the future, I think this is just a big mistake. And, also it's not a spectator sport. It's not like watching, the runs trickle in on a run chase and saying, I wonder if they'll make it, or I wonder if they won't. Now it's looking bad, now it's looking good, and we sort of chew our fingernails. It's not a spectator sport. The future depends on our actions. It's not a machine that's been set in motion and we have to read the signs and then wait for fate to strike. It's about what we do. Do we take seriously the ideas of washing hands, keeping distance, wearing a mask outside, all those kinds of things? Does the government make the right regulations about transport? Does it make the right efforts to provide water that is less intensively shared between multiple households? I mean, those are the things that will determine the future. They're not written in the stars. And so I think we need to talk very seriously about what those choices are. And I think people have been talking about that. And that's what we have to do, to engage with that and take that seriously, that it's what will happen depends on what we do. It doesn't depend on what a formula says.
And here's what we know for now from the numbers that are already in. The big areas in terms of infections are the three big metros. That is Johannesburg, it is Cape Town, it is eThekwini, Durban. So as far as the lockdown is concerned, would a best possible scenario then be, like we've seen internationally, where instead of locking down the entire country, let's say, for example, the Northwest, where the province as a whole doesn't have as many cases? Do you then lock down the 3 metros and say leave the Northwest and maybe the Northern Cape still open because they have such fewer cases in comparison?
Well, I think something along those lines has to be done. So I think this idea that everybody needs to sit at home with their hands in their laps, it's completely impossible. And it's also not particularly effective in some places, as you point out. So I think we have to look at a way of doing this not only in a way that varies from town to town or from province to province, but also that varies from time to time. And I think that's what a lot of people have been talking about. So someone thinks there's going to be a 3-phase plan, and somebody thinks it's going to be a 5-phase plan or whatever, but like load shedding schedule, and then we're going to dial it up to 3 and then back down to 2 or whatever it is. So something like that has to be the case. We simply can't continue on the current trajectory because very soon the hunger will be much worse than the epidemic. So I think this is clear for anyone to see. So yes, what you say is correct. We have to think, how can we vary it by location and by time in a way that sensibly takes into account the data. And the data is also not easy. So, chasing these counts of cases is every day subjecting ourselves to a slightly different lens, because the one day more people were screened, more people were tested, and then the next day less people were screened, or in general there's a trend towards testing more and more people because that's the right thing to do, and those are the efforts that are ramping up. And the harder you look, the more you see. How many ants are there in my garden? Well, it depends on how hard I look for ants. I can find millions, but if I don't look very closely, I don't see any. So you can't interpret how many ants I see as a serious estimate of how many there are. And COVID is not much better than that. So we have to understand that there are other sources of data, not just sort of watching the case counts trickle in. We have to look at objective measures of what's going on. We have to look at death data. We have to look at who's coming to hospital. And that's the key data in some of the parts of the world where they have that coherently, where you can run a query to ask how many people have we admitted with lung infection, how many people were confirmed to have COVID-19. That is much more reliable data. If somebody is very seriously ill, they will either die or get medical help. But if they have mild symptoms, then, well, who knows whether we'll know about that or not. So we have to also move to different types of data and then base a rule for how to find our way by time and place in a way that eats appropriate data and that doesn't sort of try to change its mind one day to the next, because that's nonsensical. You have to wait for a couple of weeks to see where you stand. Is the rate of infections increasing? Is it decreasing? Are people on average infecting, more than one other person or less than one other person? That's the kind of critical tipping point that we need to get on the right side of. And that is something we also won't even see in just counting cases if we keep looking harder and we see more cases. So we have to look at the underside, sort of the backstory, which is the actual health impacts that we can see in some of the data in the health system, and turn that into estimates of, are people infecting more than just themselves over their course of illness or less? And based on good estimates of that, we can decide which way to adjust the measures.
Professor, you and I are already in trouble with my producer in terms of time, but I have to squeeze this in. Even post the finding of a vaccine that actually works for COVID-19, would I be right to say that governments across the world would still need to have COVID-19 specific strategies because, for example, in poorer countries, those vaccines may not be as widely available as one would hope they are?
Well, probably it's good to pay attention to that. I also think, the world needs strategies to deal with TB and HIV, which are a bit more effective and a bit more having a sense of urgency, like the COVID-19 generated so easily. I think the wrong people have TB and HIV for the most part, and so that doesn't precipitate a sense of crisis, but it's an ongoing crisis. And we need to think about all of those things. So I think focusing on one disease at a time and having a COVID plan into the future doesn't sound to me like a very effective way of getting to grips with the basic state of health that we find ourselves in, which is very negative for many people.
Professor Alex Welte, such a pleasure speaking to you. Thank you, sir.